Hello, everyone. This is my Practicum experience presentation. My name is Sheila Keller, and this is part of HAP 789, our pre-Capstone professional development seminar course. In this presentation, I'll be giving an update on my Capstone proposal, the status, and the topic of the proposal. So far, I've reached out to several different contacts at my organization and discussed back and forth potential projects with other IT departments as well as clinical departments. Um, After back and forth, I decided to work with the clinical specialist in transfusion services for Centera Health at the organization I work at. So she had some uh, issues that she would like improvement on that really resonated with me. So these were issues of, most hospital departments of staffing and, turnaround time and blood inventory management. Um, the specific research topic, after discussing with her, she found that she needed to have data and analyze it in order to make better decisions or reach out to other departments to make improvements. So one of the topics was on turnaround time for specific orderables so that, they can provide the clinicians better turnaround time options as well as um, plan for staffing that's needed, in those situations for specific departments at certain hospitals. The other topic that she was looking for to help resolve an issue was with effective blood utilization. So since COVID, there has been a national blood shortage. And because of this, many hospital organizations have had to, uh, review their processes and make better plans to have more effective handling of blood products and utilization of blood products. So making sure there's no waste, there's no excessive transfusions, and making sure their inventory is tight and that they have what they need without compromising patient care and, getting the physicians uh, the blood they need for their work. For the capstone proposal, this will be conducted at Centera Health, which is my current organization that I work for, but it will be done for a different department. So the clinical department would be the transfusion services. Um, with meeting with my preceptor, we hashed out what exactly she's looking for the issues she addressed. So we came up with essentially 3 deliverables that she'd be able to use currently and in the future, which include reports generated that they do not currently have right now or have the capability to run. So these reports would kind of be created from scratch from their LIS database, and these include turnaround times for specific transfusion orders. Um, uh, the second would be data on massive transfusion protocol orders. And the third would be cross-match to transfusion ratio data specifically for all of their hospital infusion departments. So with these reports and the information she can glean from them, she'll be able to analyze and see, which departments are problem issues, the turnaround times, and for specific hospitals, to help kind of improve uh, their workflows, their processes, and also improve their blood utilization. The other large assignment for our pre-capstone course is our professional career portfolio development. Um, in general, what was your experience like creating your portfolio? Um, it was really interesting learning a bunch of new things. I'm not very big on, speaking about myself or presenting myself in the best light or I guess marketing myself. So it was interesting to learn these ways to, highlight my career, my work, and, all the things I've accomplished so far in this master's program. And in addition to that, improve my professional digital presence because I'm not very much in there in the social media realm, but establishing a LinkedIn, updating that, and even working on the portfolio gen. Those were all great things to learn. Um, was there anything that you added that you wouldn't have considered essential prior to working on it? I would say I had never written a cover letter before. So I never really thought it was something that was essential for, applying for a job. But after writing one and learning a little bit about it, I think, it may not be necessary all the time, but it does give that, personal touch. It lets the hiring manager know that you care about the job and you're really passionate about it, and you can demonstrate that in your cover letter. Um, the other thing is having a work portfolio, so something you can demonstrate all the work and projects you've done to kind of highlight your accomplishments. That's something I would have never thought of, but it makes great sense, and I think it's a great idea. And then one I learned when I met with career services is, um, when you make your resume, you should make like a kind of general template. And so if you're applying to all these different positions, the template is a great time saver. So you make it generic enough, and you add all of your accomplishments, your career, your years, all that detailed information there. And then you can cut it down and kind of modify it personally to what that position is for. And do you think this will be a useful component for future job searching and interviews? I'd say yes, yes. So when meeting with career services again, about the interview prep, I learned lots of great new tips. Um, the basically the structure of an interview, how it should go, how to prepare, um, you know, ask your questions, make sure you research the organization. You need to show that you care and you want to be part of that organization and you're excited to follow their mission and help them get there. Um, And also, I learned how to, organize my resume a little bit better. So, in the right format, so it catches their eye, they can go through it. It's efficient for the recruiter, and because they got a limited amount of time, and you got to be able to get your point across without them, losing that interest. And then the other thing is the leadership philosophy. That is something I have never really thought about or done before. So that was interesting to kind of define what it is for me to be a leader and what I stand for. Um, and then, is there more that you plan on adding? So definitely yes. I'll be adding, my capstone project, any other new project, personal or work related. I think I will add also to my career portfolio.